how long, 10 minutes?
Depends based on the number of pulses.
Okay.
Live.
All based on the number of pulses and how hot you get. So you have to tell me as you get warm, get out of there, basically.
I mean, it's warm, but it's not.
Right, so perfect. So right now what's happening is we're warming this up, and I want it to be somewhere 39 to 42. So we're at 39 already, which is great. And we're putting, now we're at 40. We're just keeping the temperature going at 41. Okay. Hi guys, we're in Manhattan and we are now doing a laser genesis treatment for overall anti-aging, pore reduction, glowing of the skin, but my patient has sensitivity and redness from rosacea. This is a very problematic thing for women, especially since it bothers them because they have to wear a significant amount of makeup to improve this, and it always comes and goes. So one of the real gold standard treatments is vascular lasers. Although V-beam was the gold standard in the past, the XLV and other newer lasers like Aerolaser are really coming to market as the best treatments for vascular laser because they literally have no downtime. My patients can walk right out of here, go onto a red carpet, they look good, they feel good. This is a 1064 microsecond wavelength that's going right through the surface, feeling heat. How does it feel?
It's warm, but not intolerable.
We're up to about 40 degrees where we want to be, 90 to 42, and 39 to 42, and it's basically tolerable for her, so she can literally walk out like nothing. This is going to shrink pores. This is going to really help her redness. Turn a little bit here. We're going to couple this with the 532 wavelength on the Cutera device, which is a little more superficial. Some call that a KTP laser. Those lasers were big in the day when we would trace small blood vessels. Now the way this was created, it was created with large spot, small contact cooling, making it where you can use this KTP for much larger veins. So this is going to be great for her cheek and chin area. We're going to do that next. But you can see how just going over the blood vessel area with the 1064, look at the improvement already. You know, it's lighting up, that's what we want. So we're now at 37 degrees, so we're in a new spot. We're going to warm that up. And the key for rosacea, you guys, is making sure that people are on the right skincare. You need to use less actives and more calming agents. Things like vitamin B, hyaluronic acid, niacin, things made of plant enzymes like chlorophyll, the MD Rejuvenaline, or fish enzymes like Restorci, for example. Isden has a product called melatonin, which is a retinol alternative melatonic. That has been very great for our rosacea patients, calming the skin down overnight. And finally, always using LED therapy. Red light really helps calm inflammation. It helps gives us much better outcomes. How's it feel?
I'm good. It's just hot.
To the right. Perfect. You're doing great. Is anyone asking anything, Joseph?
No. No, not at the moment.
And the XOV, like I said, is one of the newer of the vascular lasers. The V-beam was the one that was in the past. The issue with it was that it always required bruising protocols and it didn't have the microsecond YAG on it. So here we are now with the more advanced laser technologies using these 1064 deep wavelengths that literally just don't burn the skin. I mean, you're improving blood vessels here without any burning, any risk of burn. I don't do it based on passes, although the company tells you to do it. I do it based on the look, so when it starts to get nice and red and every area is between 40 and 42, then I feel like I'm done. Sometimes that takes, on average, it's somewhere between 2,500 and 4,000 pulses to the face. So right now I'm on 3,500, and I pretty much, if you look, like right here, I'm at 40, 41, over here, I'm at 40, 41. So almost every area I've gone, I'm at the temperatures I want to be. So as long as I did that, like right here I'm not. So I need to get there, and if that starts to burn, right? Starts to get a little hot. Right here we're getting there, so we're perfect. Once you get there, you're good.
Why is 41 the sweet spot?
Anything above it's going to burn fat. So 40, 41 is going to be tightening and pore reduction. 42 to 45, fat reduction. So I don't want to do that on her face unless she was Asian and really wanted. I'm going to keep that there. Now we're going to switch to the other laser.
So how many pulses does
This is a single pulse per area. I'll show you here in a second. I'll get there. So now I'm going to put gel on you. Okay? That gel is required wherever we go for the redness. I'm going to need a little more gel. Can you ask them, please? Actually, you know what? I think we're okay. Never mind. I think we're okay. Now, this one is different. Let me show you. This is contact cooling. There's a little cooling tip, and through that you can see the laser. You see? With all old KTPs, they were very small, 1 millimeter, 2 millimeter. With this KTP, you go up to 12 millimeters. See? Look. You go up to 12. But they tell you not to, because it could hurt them. But this is set. Now, this also feels cold. You put this on here, it's cold. That's contact cooling. That means it's going to protect her. So I'm going to do one first so she can feel on the count of 3. 1, 2, 3. Okay? Because you're going to know that's a little bit more sensitive. You okay? Okay. Why, there's supposed to be a different model for this. PJ,
They're behind you.
there should be a colored one. There it is. This one. Yeah. For me, it's fine. For you guys, it's okay. Okay. There we go. You okay? Just getting used. Everyone gets used to it.
It's okay.
Good. We start another row. Deep breath. Very good. Now this targets the superficial redness and veins.
Is this the one that increases swelling, or?
Yes. Not always, but I always tell people who can.
Drink celery juice, maybe that helps.
Maybe that will help. Let me know. Then I can tell people to take a juice right now. Red light really helps. We can send you a red light to your house, whether like in our office.
How long does it take to see the redness go away?
It takes 10 to 14 days to start to see the improvement. Turn this way. She needs 3 sessions at least. Here we go on the side. She needs to do 3 sessions, 3 to 6 weeks apart. Then every 2 to 3 months.
Why do you need to wear different colored glasses?
Because the 532 wavelength has a different setting, a different color that it gives off. So the lens has to be set for the 532. Since I'm so close. Switch your nose, bear with me. Switch your nose.
And what does the gel do?
The gel makes it so that we don't burn. With the other laser, it skips the surface. Remember, this one is on the surface. So you have to make sure the energy gets cooled the second that it touches the skin, and then it gets delivered into the skin perfectly. by using the gel, you're able to glide smoothly across, so there's no overlaps, there's no double pulses, and that distributes the energy perfectly into the skin.
That's it.
That's it, my honey.
Not bad.
How bad was it?
Not.
I know, that's what I'm saying is, even when you don't use the numbing, people realize it's not too bad.
You don't really need it. It doesn't.
It's more of a shock,
just a
right?
snap.
It's
Yeah.
like more of like a little shock. The first couple, and then you're used to
It's
it.
not painful, really.
No. So
I anticipated something totally different.
everyone gets really scared. So actually, you go look at her now, and I'll show you guys up close. You come look at her skin now. Take a look. Almost all the actual vessels are now gone, and all you see all these right here that are lit up. Those are going to disappear. That actually shows you that it was a great response. And this diffuse redness she has here means that it was a great response. So I anticipate she's going to see a really good result in about 2 weeks. Now I would like her to put a mask on her. Can you get? We'll just get a mask.